Distinguished guests, colleagues, ladies and gentlemen, good afternoon and Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Sabiha Isaac. I am chairperson of the Global Respiratory Infection Partnership and the South African Research Chair in Antibiotic Resistance and One Health at the University of KwaZulu-Natal in Durban, South Africa. Welcome to this regional workshop to develop the roadmap for AMR action by pharmacy in the Eastern Mediterranean region. I am honored to share this platform with Khalid El-Jali and Nada El-Sayed Ahmed. A little bit more about my co-facilitators. Khalid El-Jali is an infectious diseases clinical pharmacist at King Abdul Aziz University Hospital, the head of the Health Interprofessional Research Branch and head of the research unit at the Health Promotion Center at King Abdul Aziz University. He's also an honorary research fellow at the College of Pharmacy at the University of Arizona in Tucson, and he was elected the first chairman of the Infectious Diseases Pharmacy Specialty Network at the Saudi Society of Clinical Pharmacy this year. Nada Ali is a PhD student in microbiology at Alexandria University in Egypt. Her research focuses on addressing the challenge of AMR, where she aims to determine the burden of the AMR problem in Egypt in the One Health context, encompassing humans, animals, and the environment. I will begin with a brief overview of the workshop objectives. Khalid and Nada will then facilitate an interactive session to develop the roadmap for AMR action by pharmacy in the Eastern Mediterranean region. I will end the workshop with an overview of the next steps. These set of regional workshops build on the global session we held on Saturday last week on September 12th. If you've missed that global workshop, the recording of it is available on the FIP website together with other webcasts and videos. And just a reminder that a recording of this workshop will also be available on the FIP website for those that do not manage to participate this afternoon. This workshop the objective of the workshop is to work together to drive regional initiatives in AMR by translating policy into action. During this workshop, we will co-develop and make a commitment to a regional roadmap for AMR success in pharmacy. GRIP is honored to partner with the International Pharmacy Federation to drive AMR action in a new decade by pharmacy. So the question arises, why pharmacists? To answer this, I want to draw on the pentagonal framework of the Global Respiratory Infection Partnership. The framework speaks to the role of policy, prescribers, pharmacists, and patients on the prevention of antimicrobial resistance. In terms of policy, the framework speaks to policy endorsed by local governments and clinical communities of practice that advance antimicrobial stewardship and conservation. It includes patient empowerment and education about appropriate antibiotic use and symptomatic treatment options. Pharmacy guidance is also given on their stewardship role as educators, providing patients with advice and support on infection management and when to consult a doctor. Also included is prescriber guidance on antibiotic stewardship and effective dialogue with patients. And all of these together are aimed to prevent resistance by the rational use of antibiotics. Now, without any bias, I state that pharmacists are pivotal in this framework for many reasons. Firstly, pharmacists validate or confirm prescribing practice and thus have tacit oversight with prescribers. Pharmacists are strategically placed to educate patients and effect behavior change in terms of patient demand for antibiotics. Pharmacists are critical to the implementation of policy as well as the generation of evidence to inform policy-related interventions. And finally, pharmacists prevent antibiotic resistance by impacting on prescribing practice, patient behavior, and policy implementation. You will recall from the workshop on the 12th that we decided to focus on 3 of the 5 strategic objectives of the Global Action Plan on Antimicrobial Resistance that resonate most with the policy and practice roles of the pharmacists. These are to improve awareness and understanding of AMR through effective communication, education, and training, to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures, and to optimize the use of antimicrobial medicines. We want to look at all of these initiatives either as initiatives in education, policy, or public health, and include the COM-B model. We wanted to include the COM-B model because we believe that the pharmacist has immense capability, opportunity, and motivation to prevent, contain, and mitigate AMR. Pharmacists have the capability to address AMR because they have the knowledge, skills, abilities, or proficiencies acquired via education and practice. They are motivated to prevent, contain, and mitigate AMR and eliminate it as a public health threat. And finally, they have the opportunity to achieve this by leveraging country commitments to the United Nations Declaration and the Pharmacy Association's commitment to the FIP policy statement on AMR. So regional initiatives can address education, policy, or public health in any of the 3 strategic objectives of the Global Action Plan. So let's start the interactive part of this workshop going, and it's question time. So the very first question is, has your country approved a national action plan? So this can be a yes, no, or I don't know. For those of you that are involved in antimicrobial resistance work, you will know that the World Health Assembly required all of its member states to have national action plans in place by May 2017. But this work is still ongoing, and not all countries around the world have actually developed one. There are many that have been developed, but are not yet approved by governments. So let's see how the Eastern Mediterranean region is doing in terms of the, okay, so a little under half of the countries have approved national action plans. Many of the participants don't know, and there's just is no action plan. So let's then ask the next question. The next question is the role, for those countries that do have a defined national action plan, is the role of pharmacy, excuse me, clearly defined in the plan? So again, it's a yes, no, or I don't know. From my experience of national action plans, it's usually the ministries that are identified as the key implementers, and not necessarily subdivisions of the ministry. So I would be very interested to know whether any of your national action plans have mentioned pharmacy or pharmacists very specifically. And wow, more than a third have actually identified the role of pharmacy in the action plan. So this is really good, and I'm very curious to see how the pharmacy role is identified and going to be implemented in the Eastern Mediterranean region. So thank you very much for that. So we want to populate this table with as many initiatives as possible, after which we will determine timeframes and responsible entities. So Khalid and Nada have worked together and collaborated with others to determine a number of initiatives for the Eastern Mediterranean region. These by no means cover all of the initiatives that could be run in the region, and we ask you to please use the chat function and the Q&A function to add any further initiatives that you think would make a difference in the Eastern Mediterranean. So with that, it's my pleasure to hand over to Khalid and Nada. All the best.
Thank you very much, Sabiha. Thank you, FIP and GREP, for the kind invitation and the great efforts. Also the Chilo Health for their support. So these insights you see here are the results of the survey that was sent a few days ago. Thank you very much, everyone who responded to the survey. Now, these are global insights, but we want to get also more specific insights from the EMRO region during this workshop. And also my colleague Nada will share also some specific insight. From the survey, we found that there were 5 key barriers And these were, number one, education and training, which is a big barrier. Currently, it seems generally we don't have sufficient and robust pharmacy education and training on antimicrobial resistance, and how to reduce this antimicrobial resistance with stewardship and other strategies. Antimicrobial resistance doesn't seem to get good support, honestly, from organizations and institutions, including financial support. Despite that, it is an urgent health concern, but many organizations might not feel it is a responsibility, or it might not be urgent compared to other priorities. Number three, there is a low recognition for pharmacists in many countries and many areas, and there is little collaboration, interprofessional collaboration, including pharmacists and pharmacy organizations in terms of reducing the antimicrobial resistance. Next slide, please. Okay. Accountability and leadership were also lacking in terms of antimicrobial resistant strategy implementation and monitoring. And the last barrier is that there are either no regulation or inadequate enforcement of the regulation regarding antibiotic prescribing. So these were the 5 key barriers we had. Thank you very much for everyone who responded. And overall, it was interesting that about half of respondents were unaware or not actioning objectives outlined by the Global Action Plan on Antimicrobial Resistance. And with that, my colleague Nada will take us into some specific examples we got from our region.
Thank you so much, Khaled. And hello, everyone. I'm going to read with you some of the comments that we received from you during the survey. And these comments actually were inspiring and were taken into consideration while developing the initiatives for the global roadmap. The first comment was from Lebanon, in which the participant thinks that the Ministry of Public Health in the country actually is overwhelmed with the crisis of COVID-19 and of the port explosion. So raising awareness about antimicrobial resistance is not a top priority right now. In another comment from Qatar, the participant thought that education is a key for raising awareness among pharmacists and among patients. And from Pakistan, there was a comment mentioning how it's important to coordinate between staff to raise awareness about the antimicrobial resistance, and how it's crucial to develop strong policies to restrict the inappropriate use of antibiotics. Next slide, please. This was the regional roadmap that we developed with the help of our networks. And now I will hand over back to Khaled to tell you about the first initiative.
Thank you very much, Nida. These are, as Nida said, some suggested initiatives. And, out of the strategic objectives of the Global Action Plan on Antimicrobial Resistance, we have 3 objectives most relevant to pharmacy. So the number 1 objective is improving awareness and understanding of antimicrobial resistance through effective communication, education, and training. And as you saw from the survey that was sent, one of the biggest barriers is education and training. So we have 3 suggested initiatives to address this problem. So number 1, as an example, provide simplified patient education to raise awareness about antimicrobial resistance, the proper use of antibiotics, and the role of symptomatic relief to reduce inappropriate use, such as upper respiratory tract infection. The public and the non-healthcare professionals, they need specific and patient-friendly, simplified way of education. They need, their own type of materials, maybe a specific type of lectures for the public, because antimicrobial resistance is very complicated. It needs to be explained in a simple language and in a lay language to the public. And we could do that by not only the lectures, but infographics, for example, brochures, some videos, some interactive and videos, less scientific, more fun to watch, directed to the public. When you talk about the antimicrobial resistance, some patients think, for example, that their body, gonna become resistant, not the bacteria itself. Or they might think, well, why it is a big problem? If someone took an antibiotic inappropriately, they're gonna harm themselves. But in reality, you are not only harming yourself, but you are harming others, because the bacteria that you have, if it becomes resistant, it could transmit to other people and harm the whole society. Proper use of antibiotics, for example, some people don't take the antibiotic at the right time, or they might miss some doses. This is not good for resistance. And one of the most common misuse in, I think, any community is giving antibiotics or antibacterials for viral infections, especially upper respiratory tract infection. And pharmacists can encourage and promote the use of symptomatic relief instead of antibiotic that doesn't help with viral infection and could harm the patient due to side effects and increase in resistance. The second initiative is including interactive. So I'm sorry, this initiative will be discussed by my colleague Nada.
First, the poll question.
So before we go to the next one, can we just do the poll?
Yeah.
Excellent. Okay, so this is the poll. If you can answer within 20 or 30 seconds. So by when could this initiative be implemented in your country, which is simplified patient education on antimicrobial resistance and symptomatic relief treatment?
We could think about this in terms of the World Antibiotic Awareness Week that is coming up in November this year. And we have about a little less than 2 months that we can start developing simplified information using the World Health Organization templates.
Interesting. So the results are distributed, but it seems 40% think we can achieve this by next year, 2021, followed by the 30% also said 2022. So around 70% say we can achieve it in 1 or 2 years at max. This is interesting.
Okay, thank you, Khaled. Now with the next initiative, which also aligns with the objective of improving awareness about the problem. We thought that we need to include interactive sessions or lectures into the curricula of undergraduate students about the antimicrobial resistance problem. Usually, those kinds of courses, when they are provided to students in medical schools, pharmacy schools, dentistry, or any school dealing with antibiotics, they are in the form of lectures, theoretical lectures, and at the end of the course, the students receive a written exam, pass the exam, and that's it. But we thought that we need to consider more interactive sessions to be included in that course, or maybe develop a new course into the curricula to make the students actually share their thoughts about the problem and to discuss the problem with their professors and maybe prepare presentations about the topic, so that when they graduate, they can really advocate against the problem of antimicrobial resistance. Additionally, in those kinds of interactive courses, the students can participate in role plays, in games, to get the feel of real pharmacy situations or real situations when the physician dealing with patients, and how they are going to use different communication skills to deal with different kinds of patients, how they are going to convince them that they don't need antibiotics for viral infections. So this actually needs training and practicing in the phase of undergraduate studies. So what do you think? Please share your thoughts with this poll question. When do you think this is applicable in your country? When it's possible in the universities at your place to actually modify a little bit the courses about antimicrobial resistance to make them more fun, to make them more interactive with the students? Next year, more years? What do you think?
And just to add here, Nada, that the WHO has developed a competency framework for health workforce education and training, and pharmacy features very prominently in there. So it's the framework as well as curriculum, which gives you an idea of what types of topics and to what depth they should be covered for each of the healthcare professionals. And they focus on doctors, nurses, pharmacists, and lab techs, just as a point of interest. It's available on the World Health Organization website.
Yes, that would be a great resource actually for the universities to use. Wow, that's promising actually. So a little bit more than 40% thinks that that's applicable in the next year. And some of you think that it needs more time, and actually that's understandable because sometimes it's difficult in some countries to add courses, new courses to the already developed curriculum. Now we will hand over to Khaled to talk about the next initiative.
Thank you very much, Nada. And if I might quickly just add one quick comment. So because I'm an assistant professor in the Faculty of Pharmacy, and I agree that the creating a new course can be difficult. It takes time, but adding lectures is not difficult. And actually, I remember when I returned back from US and I started teaching, my course in infectious disease, I added a whole lecture about antibiotic stewardship. And, it's part of the exam. So people, get the chance to study this. And in the rotation in the pharmacy intern year also, there is a rotation for antibiotic stewardship. So the third initiative. Okay, so the third initiative is the antibiotic stewardship certification by FIP, and it could be certified by different region and whether it's hospital versus community pharmacy. This is one of the suggested initiatives. So, and it addressed the problem with the education and training. Many pharmacists want to do something about antimicrobial resistance, but they might not have enough knowledge, or they want more guidance. So maybe if there is this certification, by FIP, and it teaches you what you need to do, to optimize antibiotic stewardship and different strategies. Teaching you the how you can reduce antimicrobial resistance. And, maybe even in the EMRO region, it could be one certificate for the whole region, or it could be maybe, by similar regions, because also maybe not all countries in the EMRO region are exactly the same. Maybe there are some differences. For example, one country might already have a law enforced to prohibit antibiotic dispensing without prescription. Other countries might still have this problem. Also, the community pharmacy is different than the hospital pharmacy. You have different, environment, different type of interventions. And now maybe we can move to the vote. So by when you think this initiative can be implemented in your country? How urgent do you want FIP to create this certification? Okay, nice. So about half, they want this type of certification urgently. So in less than a year. And so that's very encouraging. Thank you very much. And now my colleague Nada will cover these initiatives.
Thank you so much, Khaled. Now with the initiatives that align with the second strategic objective of reducing the incidence of infection. The first initiative we thought about was to properly dispose the pharmacy waste and to use suitable containers for sharp objects. Usually in many countries in the region, simple wounds and simple burns can actually be managed and treated at the community pharmacies. Additionally, patients can receive injectable medications inside the pharmacy itself, which exposes the pharmacy staff, the pharmacy visitors, and the local community to the threat of serious infections. That's why it's really crucial to implement strict infection control measures inside the community pharmacies by wearing the suitable personal equipment, by using suitable containers for sharp objects, and using the labeled containers with biohazard waste on it, and safely dispose all of that afterwards. So it's really important to implement all of those measures inside the community pharmacies. What do you think about this initiative? It's possible for you to apply it at your country. If it's already there, that's wonderful. If you are willing to apply this in the pharmacy you're working at or at your country, is it possible to be done next year? Hope so. In a few seconds, we will be seeing your results. Okay, now with the results of the poll question. Oh, wonderful. That's really encouraging, actually, that the majority of you think that it's possible to be applied actually this next year. And there are some of you think that it needs more time, but we hope that soon enough, because it's really important to protect against serious infections. With the next initiative, we thought that community pharmacies can actually be a place for the patients to receive different kinds of medical services that can be provided at the community pharmacy, and to encourage them to receive the annual vaccine for influenza. Those kinds of services may include diagnostic tests that also can be provided in the pharmacy. As we all know, and as research says, that in most cases, the inappropriate use of antibiotics is due to upper respiratory tract infections, including influenza, including common cold and sore throat, which usually are due to viral reasons. So we thought that if we encourage people to receive the annual influenza shot, we are going to decrease the burden of these kinds of infection, and so we would decrease the use of antibiotics inappropriately. Just a second for the poll. Additionally, for diagnostic tests, those kinds of tests usually include the assessment of chronic diseases like diabetes, but they can also include tests for some of the infectious diseases. For example, recently in Egypt, there was a huge campaign, nationwide campaign, that actually depended on pharmacists to screen all the population for hepatitis C infections. Those kinds of services, when they are provided at the community pharmacy, they actually help to build a stronger relationship between the pharmacist and the nearby patients, and to raise awareness about infection control measures and about the antimicrobial resistance. So this is really important. Please share your thoughts with this question. When do you think this is possible to be applied? When do you think you can actually provide those kinds of services in your pharmacy or in the country other pharmacies can provide? If you're already doing this, that's also great. But if you're willing to do this, when it's possible to be applied. Now with the results. That's encouraging, that's promising. Actually, more than half of you think that it's possible to be done in a few months, and a few of you think that it needs more time, maybe 2 years more. That's good, that's promising. Now we are moving to the next slide, and I will hand over back to Khaled to talk to you about the rest of the initiatives.
Excellent, Nada, thank you very much.
Thank you.
So the third strategic objective that is relevant to pharmacy is optimizing the use of antimicrobial medicines if we as pharmacists didn't improve the use of medication, especially antimicrobial, who will? So we have a big responsibility to do that. And one of the suggested initiatives is enforcing law regulations that prohibit dispensing antimicrobials without prescriptions. I know some of you might already have this in their country, but I think most countries in the region, either they don't have the law, they don't have the regulation, or they have the regulation, but honestly, many times they are not enforced. So if they are not enforced, if there are no consequences when the pharmacist dispense without a prescription, then it's going to continue. And let me share with you, the example of Saudi Arabia, for example. So right now, we finally have law, enforced. But before, at some point, maybe we didn't have the law. And then we had the law and regulation that prohibit dispensing for several years. But honestly, community pharmacists were not following that most of the time. And this is confirmed by several studies in several cities in Saudi Arabia. But finally, what happened, before 1 or 2 years, finally, there was more pressure on that, and multidisciplinary team, including physicians, microbiologists, and pharmacists, and other healthcare professionals. They finally, they wrote a letter submitted to the policymaker in the Ministry of Health, and finally, it was signed with clear consequences. What will happen when the pharmacist dispense without prescription? This include fines and other measures. And there was a big campaign about this, and finally, successfully, it was done. Now it's very difficult, and to get the antibiotic without the prescription finally. But a lot of countries in the region still, they either don't have the law, or they have the law, but it's not enforced. It's not very easy to start a regulation, but it can be done. It's possible. And, any one of you, if they are, in a high position in the country, or they can reach out to policymakers, please encourage this. Please try to push, so the law start, or the regulation, get enforced more strictly. Because, education is great. You can do education for pharmacists. Please don't dispense. But to be honest, from my experience and what I saw in Saudi Arabia, it was not enough. No matter how many education we did, still some pharmacists dispense without a prescription. But when you have a law, a clear law, strict law, I think that is the best solution. And the other, initiative is, telehealth is growing. Telehealth and train the trainer. So we could apply this concept to antibiotic stewardship. So many of you, they might have some knowledge, for example, or they might attend a course and learn a few stuff, but in practice they might see different reality, or they might not know how to convince the physician, or how to exactly apply some interventions. Imagine if you have some guidance and you can talk and communicate with an expert in antibiotic stewardship. It can be done virtually. And this expert gonna guide you in this patient, with this intervention, how you can do it. I think this can be very helpful. Then you enable more pharmacists to know how to do interventions in reality in their practice setting. And when they learn how to do that, and when they gain more skills, then they're gonna infect other people, not with virus, infect other people with these new skills. Mm-hmm. And this can keep growing. So I think this is one of the most exciting initiative I'm thinking about. And now maybe we can move to the vote to, so you can tell us, if it's possible to implement this early in your country.
Khalid, I think we forgot to vote on the previous one, so can we do one after the other?
Oh, okay, I apologize. Okay.
No,
Yeah,
no problem. You're rolling very well with this, so we'll just go back. Thank you.
Excellent, okay. Okay, so I think we have the results for the second initiative. Very nice. More than half, they want this, very urgently in a year, 2021, and 25% also in 2022. So more than 75% want this urgently. Very encouraging. And now going back, I apologize for that, going back to the first one. So when do you want the regulations prohibiting antibiotic dispensing without prescription to start or to be enforced? Okay, very nice. So one of the highest percentages, more than 70% or 75%, 3/4 said we want this in 2021. And even for the rest, I understand why they said later, because, changing the regulation or implementing new regulation can take time. So it's understandable, but I'm glad, it's very encouraging. Most of you think we want this as urgent as possible. And now it's the time to get your feedback on the initiative we shared. Please use the chat and Q&A options also if you want to add anything. But now we want to ask you which 3 of the initiatives you feel will be most impactful in your region or country. If you can pick 3 of the most important, which one you're going to choose? Oh, wow. Okay, it's very interesting. So number 1 is simplified patient education on AMR and symptomatic relief treatment. Very nice. I agree with you. This one is not difficult to do. Videos or infographic or the campaigns. I think there is a big need about this. And it could achieve one of the strategic objectives. With regard to education, the public is the big part of the. They can be. They can have a great impact on the antimicrobial resistance. As you know, sometimes the public put pressure on the prescriber or the pharmacist if they can dispense without a prescription in some countries. So, we really need to educate them. I'm glad this is your opinion. You think patient education comes first out of the initiative, and it's easy to do, maybe compared to some other initiatives. And maybe the next one, selected by about 50%, is the regulation prohibiting antibiotic dispensing without prescription. I agree with you. Few countries have this already, but some countries, they need to do this urgently. I agree with you. And maybe the next one, the third one, is the certification, for antibiotic stewardship. Very nice. And then after that, we have the, having the interactive antimicrobial resistant lectures in the undergraduate curricula. So, this should start from the college, not only after graduation. After that, maybe we have the telehealth training by maybe 1/4 of the respondents. And the last one, or also I forgot also we have the community pharmacy, the vaccination and undiagnostic test as well. Last one, maybe a proper disposal of pharmacy waste and sharp by 17%. Very nice, very encouraging. It seems the education, which was maybe the biggest barrier, it makes sense now. The initiative, target this problem about the education. So education of the public, education of the pharmacists in the colleges, and also the regulations. Very nice. Thank you very much.
Thank you so much, Khaled. And now feel free to add any other initiatives in the question and answers or the chat box. If you have any answers or any ideas, you can share with us.
Thank you very much. There are so many good comments in the chat box as well as in the Q&A, and I've tried to answer a number of them as I was listening in. But Nada and Khalid, I'm going to pick out a few of them that we will try to answer live for the short period of time that we have remaining. So there was quite a bit of discussion around behavior change in the part of patients, insisting on or demanding antimicrobial, but not necessarily finishing the course. But there also the behavior change pharmacists who dispense antimicrobials. And added to this, the one question that we had was, how do we remove the commercial incentive from the provision of antibiotics by pharmacists? So I'm going to let you answer those questions from your perspective.
Okay, Khalid, you can go.
Okay, Sabiha, it was actually disconnecting. So I didn't hear part of it, but
repeat, it's behavior change on the part of patients and pharmacists.
Yes.
And added to it, how do we remove the financial incentive for providing antibiotics without prescription?
Okay, yeah, I think the second part about the incentive, I think Nada have more experience than me about the community pharmacy practice, but I think if we have a law that prohibits dispensing without prescriptions, then we solve the problem, because now the pharmacist cannot dispense without prescription. But if there is no law, or if it's not enforced, then maybe we can start by targeting these problems with the initiative. So we make it maybe mandatory. If we can't start this law, maybe make it mandatory. Don't include the antibiotics in those incentives. Pick any other drug, with all respect to any medication. But antimicrobial is very sensitive. They are different than other medications. Antimicrobial might stop working after a few years, but the other medication, with all respect to all of them, antihypertensive or painkillers, it's gonna work after 1,000 years, 1 million years, it's gonna work. But antimicrobial, they can stop working very fast.
Excellent, Khalid. I completely agree with you. Yeah. And I think that a lot of countries do have really good regulation, but then capability. So to get the people to go in and monitor the farmers is really lacking, and we really need the manpower or the woman power on the ground to be able to achieve that. Excellent. We had a number of questions. Nada, I had one direct question for Egypt, and it was, what are the types of interventions that are being implemented in Egypt on AMR? And then Nada, you answer that first, but can I also just then come in about lots of queries around what would be the best type of stewardship guidelines to implement in the Eastern Mediterranean region? So Nada, you go first with what's happening with AMR in Egypt, and then the both of you can answer about stewardship. Thank you.
Well, the situation in Egypt, antimicrobial resistance is not a top priority in the country, unfortunately. We are right now focusing on one of the really common viral infections in the country, which is hepatitis C. So the manpower and the funding goes to this particular area, and also other parts of malnutrition and so on. But antimicrobial resistance is not the priority. There are individual actions happening maybe by antimicrobial stewardship programs applied in many of the hospitals. The role of clinical pharmacists actually is huge right now, and they're doing a great job with this part. They are dealing with physicians to modify the regimens and modify the types of medications given to de-escalate the use of antibiotics as much as they can. So it's maybe individual efforts, not like nationwide efforts.
Khalid, do you want to answer the stewardship one?
So, sorry, Sabiha, what was the stewardship question?
Just to ask that what would you recommend as guidelines to implement stewardship in the hospital setting or in the community setting? What would be the best guideline for the Eastern Mediterranean region? We are aware that the WHO has a tool. British Society of Antimicrobial Chemotherapy has one, as does the one that is preferred in EMRO.
Okay, I will try to answer. The voice was the sound was disconnecting, but I think you were asking about what type of resources might be beneficial for the EMRO region, right? For stewardship.
That's correct. Yes, in stewardship.
Okay, nice. Okay, I think in the EMRO region we could use the general resources for antibiotic stewardship. This is number one. For example, guidelines like the IDSA guideline for implementing stewardship, for example. Several, international societies have resources for the stewardship. Do we have some maybe local resources? Yes, we have. I'm seeing a lot of workshops and lectures about stewardship, throughout the year. Also, for example, there is the British Society of Antimicrobial Chemotherapy electronic book. It's free. I had the pleasure to co-author one of the chapters. This is a nice book, interactive, and also BSAC also did actually a course specifically for our area, and it included several speakers from our area, some successful stories. I think this course is very good, and several other organizations are trying to make some local resources. Each country sometimes have their own resources. For example, Saudi, for example, the Ministry of Health, they have a guideline, a local guideline for using antibiotics in the hospital in Saudi. Also, sometimes the accreditation, the national accreditation is helpful as well, because the accreditation will say it's mandatory, that you implement stewardship. And right now, the Sibahi accreditation, for example, in Saudi, require the hospital to have stewardship program. They have a number of requirements. For example, you have to have, restrict the antibiotic list. You have to have a team, multidisciplinary. But I think also it's up to the hospital if they can add more, interventions. That would be very good.
So thank you very much. We've got lots and lots of questions and not enough time. I'm going to ask the last two questions on alternatives to antibiotics. And I want you to speak about these antibiotic alternatives in the context of symptomatic treatment, and specifically for upper respiratory tract infections, but also in the context of vaccination. So we've had questions on symptomatic treatment, not antibiotic use, and how vaccinations can be used to reduce antibiotic use. So these are the last two questions for this session. Please go ahead.
Okay. Okay, so for the first question, maybe I will answer, and then maybe Nada, if you want to add anything. So it's about the alternative to antibiotics. First, when we talk about the alternatives, it doesn't have to be pharmacological alternative. Sometimes non-pharmacological measures. Sometimes just rest and wait, and the virus gonna, it's self-limiting, like common cold. You don't really have to take anything most of the time. If you want to take something, then don't take an antibacterial, because it doesn't make any sense. You have virus, the antibiotic will not do anything except harm you and the community. So use alternative. You can treat the symptoms. So if you have nasal congestion, you can take a decongestant. You have cough, you take anti-cough. You have headache, you have fever, you take something for pain and fever. So as simple as that. What type of symptoms do you have? Then you can use medication for those symptoms. And you have to be careful, of course. So for example, you shouldn't take decongestant long courses when you have like cardiovascular disease, hypertension. You have to be careful, of course, like any other medication. So those about the alternative. I think the most important is upper respiratory tract infection. Many people take antibiotics, but they should treat the symptoms. Also, diarrhea is a big problem in the community. Metronidazole is widely used in the Emerald region for diarrhea, and it's wrong. Metronidazole covers anaerobes. The diarrhea is caused most of the time by virus. If it's not a virus, then if it's a bacteria, then mostly it's gram negative. Metronidazole doesn't cover gram negative, so it doesn't make any sense to give metronidazole. Nada, do you want to add anything about this question?
I totally agree with you, Khaled. And actually, in the era of COVID-19, we exactly know how antibiotics cannot work for viral infections. COVID-19 is an example. You just treat the symptoms. Up till now, we don't have like the vaccine for it. We don't have an exact treatment for it. We just try to treat it with the available options. But it's the same with other viral infections. Influenza, for example, common cold, for example. These are all viral infections. You do not intervene with antibiotics except if there is a proven secondary bacterial infection, which is not the case with most of the patients with viral infections. So vaccination would be a great alternative, actually, because using the flu vaccine would decrease the burden of those kinds of upper respiratory tract infections. So would decrease the use of inappropriate antibiotics prescribed for those kinds of cases.
Yeah, I totally agree with you, Nada. Yeah. So with the vaccine question, I mean, if we didn't get the infection from the first place, then the patient would not need to seek for antibiotics or other treatment. So if we prevent infection from the first place, then we're gonna indirectly reduce, the use of antibiotics.
Yes, exactly.
So that's really excellent from the both of you. We really, really appreciate all of your insights. And I think this is the first session that has actually brought up COVID-19 and the impact of COVID-19 on antimicrobial resistance, the fact that it is a viral infection for which antibiotics don't work, and how important symptomatic treatment is, especially as almost 80% or more of COVID-19 patients are actually managed in the community and would seek the services of a pharmacist. So well done. Thank you for very comprehensively answering all of the questions, and we really, really appreciate it. I'm now going to ask, I'm going to get to the last few slides. Thank you so much for that. If we can just get through to the next steps, please, Erin. Great. Okay, we are on the next steps. Wonderful. So first of all, we want to thank all of the for giving us such valuable insights in terms of the initiatives that, if those of you that attended the meeting of the 12th, or the mission of the FIP development goal related to AMR and the global workshop, and both the development goal and the FIP AMR commission will be launched on the week of the 21st. The very first deliverable of the AMR Commission will be the regional and global roadmaps to which you have all contributed today. And we want to make sure that you engage with this roadmap and the launch of the Commission, which will be on the 24th at 1 p.m. Eastern European time, Central European time. So the next steps are, you've helped us a lot to identify key actions and engender regional comments to AMR, action in pharmacy. The roadmap is designed to be a living document, an iterative tool that will act as a compass to guide actions globally, sustaining momentum and evaluating progress. And it will be revisited and revised annually, culminating in a presentation at the FIP World Congress in 2023, where there will be a special work. This conference is going to be in Cape Town, so we look forward to hosting you all in South Africa. So thank you very much for all of that. And then finally, my acknowledgements. In closing, I would like to acknowledge the people who have made all of this possible. Catherine Duggan from the FIP CEO for advancing the antimicrobial resistance and antimicrobial stewardship discussions at FIP. At FIP, Adrian Shepherd for his visionary leadership of GRIP, Jane, Erin, Ashlyn from Cello Health, and then Carola and Susanna from FIP. To Nada and Khalid, you have exceeded our expectations and you were the best session of the day. And I can say that because I'm chairing all of them. So thank you very much. The young pharmacists have shown us the way. And to all of the participants, thank you for your time. Thank you for your inputs. And please don't stop. We would really love to hear from you as this develops afternoon and evening further. Thank you.
Thank you so much.
Thank you very much, Sabiha. Thank you.